CT scan of abdomen and pelvis, contrast enhanced CT scan. This is a set of axial images followed by some coronal reconstructions, and this set of images has been copied from www.redrounds.com with kind permission. The purpose of this video is to get familiar with the anatomical structures as seen on CT scan rather than discussing any pathology. Although we will discuss some major pathologies that are visible on the CT scan. So the first lies is at the level of ZP sternum, just above the level of diaphragm. So these are lungs, the black things are lungs, just above the diaphragm. This is the right side of the patient, this is the left side of the patient. Traditionally the right side of the patient should be on your left hand side if you're looking at an image, an X-ray or a CT scan or MRI. This is the anterior aspect, this is the posterior aspect, and this is the CT scan table on which patient is lying. This is thoracic vertebra, ribs, here, these are ribs. This is heart, inferior vena cava, aorta, and esophagus with a little bit of air in it. These are pulmonary vessels that have become more visible because of the presence of contrast in them. We'll move down towards the feet slowly. 3 hepatic veins joining the inferior vena cava, aorta. You are beginning to see the liver on the right side, spleen, and this is stomach, which is empty at the moment, descending aorta, stomach, enlarged spleen, enlarged liver. This is pancreas, this is upper pole of kidney. Aorta is giving off branches. You cannot still see the right kidney here, which is pushed down. This is where superior mesenteric vein should be. It joins the splenic vein to form the hepatic portal vein, and superior mesenteric vein is huge and is actually pushing the pancreas up. This should be much smaller than aorta, and you are beginning to see the reason. There is a blood clot in superior mesenteric vein, which is probably the reason why it is so much dilated. This is left renal vein, which is passing over the aorta to join the inferior vena cava. As you can see it, aorta is giving off left renal artery here and right renal artery here. You can clearly see the blood clot in the superior mesenteric vein. This is superior mesenteric artery. Superior mesenteric vein should be a bit bigger than superior mesenteric artery. This is splenic flexure of the colon, spleen, left kidney. You cannot still cannot see the right kidney. Aorta, intestines, huge superior mesenteric vein. This patient is on oral contraceptives, and one of the complications of oral contraceptives is that you can develop blood clots. This blood clot is unlikely to go into the lungs, but these patients can also develop blood clots in the veins of the legs, which is known as deep vein thrombosis. And the blood clots from DVTs or deep vein thrombosis can actually pass through the inferior vena cava. They can pass through the heart, and they will eventually end up in lungs, which is known as pulmonary embolism. It's a huge clot. You're beginning to see the right kidney here. Liver is also enlarged. Transverse colon here. right kidney. Transverse colon is clearly visible with air in it. Aorta has been divided into two branches. These are psoas muscles here. This is fat below the skin. Psoas muscles, pelvic bones, and coronal reconstructions. So this is the right hemidiaphragm, left hemidiaphragm, liver, right kidney which is pushed down, as you can clearly see it now. This is the blood clot in supramesenteric vein, which collects the blood from intestines and takes it to the liver. Heart here, and huge blood clot in supramesenteric vein. Thank you very much.